So let's talk about why a person would help another person, how a person would help someone in need like this, and to recognize some problems. She recognized that there was something wrong in the leg. Yes. So for the lay public, what we need to do is tell them some things that they can do quickly. And that is look at the face. So do you mind if we examine you a little bit?
Not at all.
Would you kindly smile? Okay. And for the people in the audience, there's a little bit of a droop on the left side of the face. And will you put your arm out for me? Yes. Excellent. Excellent. Okay, good. And that is also a weakness on one side. It's still on this, it's on the left face, the left arm, and there was no movement in the left leg at that time.
Correct. Initially, I couldn't move my left leg at all, so I could not even reach up to the counter to stand up. And then my wife and I were talking, and she decided to dial 911, and she realized that my speech was a little bit unusual in that it was slightly slurred and maybe a little bit garbled, but not my normal speech pattern. And so she recognized that something was going on, and so she did two very important things. One is that she told the 911 switchboard operator that she thought it's possible I could be having a stroke, and they noted the time.
Yes.
Because that's the other thing that people should know, is noting the time of symptoms onset is one of the most important predictors of what treatment can then be rendered at what time for that patient.
And for the audience, the reason we're talking about that is because later when you arrived at the Billings Clinic, where we have worked very hard to become stroke certified by Joint Commission of Hospitals, American Hospitals, we have a team in place that would say this person needs a certain drug. It's called TPA, tissue, as you well know, tissue plasminogen activator. And for your wife to do all of those things, it was click, 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 exactly what was needed, because the onset is, the time of onset is exceedingly important. The reason for that is, as you know, outside the window of that 3-hour window at that time, we couldn't give you the TPA.
Right, so she noticed my symptoms immediately, made the call immediately, notified them that she felt I might be having a stroke, noted the time, and when the first responders got there, the EMT who first saw me did a great exam, and his exam, interestingly, allowed me to recognize just how weak I was on the left, so I kind of knew that her diagnosis, my wife's diagnosis, was correct, that I was having a stroke, and I knew what that meant. And then he called in to the Billings Clinic to notify the ER that he agreed and felt that I was having a stroke, so that the stroke team was activated.
You bet.
So that by the time I got there by ambulance, I was greeted by colleagues that work in the emergency department whom I know all very well, and they were able to assess me by examination as well as by specialty x-ray studies like CT scan of my brain to recognize that I was having a stroke, and then to administer the TPA, which I think most people would probably know by kind of the name clot-busting drug, because I had a clot in my brain that was causing the stroke. So I did get the TPA rather quickly.
Yes.
And then it was determined that I would be transported for further care.
You bet.
Which was absolutely appropriate.
You
and
bet.
So we got ready, my wife and I, to head up to the airport to fly out to Denver.
You bet. So would you be willing to tell the audience how old you are?
I just turned 46 years old.
Okay. The reason that's important is a year ago you were only 45. Gentlemen and women and ladies and gentlemen in their 40s generally do not think they are susceptible to stroke. I'd like for the audience to know that anybody can have a stroke, including babies in utero. So stroke is yes, it is an older disease, but people in their 40s, in the prime of their health, can have a stroke. When you were seen in the emergency room, it was decided very quickly by the neurologist to send you to Swedish. And the reason for that is for possibility of interventional care. Tell us how the plane ride went.
Well, the ride itself went fine. It was a small twin-engine plane that's used for fixed-wing transport. I wasn't in significant pain on the ride, which was very nice, and Tracy, my wife, was with me, so that was extremely comforting, and the flight care crew was amazing. But I definitely had a feeling of dread when I got on the plane.
Sure.
That as we took off, I had this innate feeling that I wasn't going to make it to Denver.
You bet.
So when we landed in Denver, I was somewhat surprised.
You bet.
But happy.
And the reason that's the reason we talked about this and the dread is because that's very common for people who've had a stroke. And what happens is the computer is not working, and so a specific part of the body is not working. When you got to Swedish, they found out you had a dissection.
Correct.
Yes, a dissection of the artery.
Right. So the carotid artery in my neck had a dissection, which is essentially the inner wall splitting away from the outer wall, and then between those two walls in the artery, the blood collects and formed a clot that then went up to my brain and caused the stroke. So a significant portion of the right side of my brain was not receiving any blood at all.
That's right.
And that's why the left side of my body wasn't working, because the right side of the brain controls the left side of the body.
So after a long period of time, you had physical medicine rehabilitation, you had physical therapists, speech therapists, occupational therapists, and I would like for you to tell the audience where you were, which was plegic on the left side. Plegic means no movement, and now where are you?
I've had a lot of progression. It's just today been 11 months, and so it's a frustratingly slow process to recover from any nerve injury, be it traumatic or ischemic stroke or a traumatic brain injury, or if a nerve gets cut inadvertently by a knife or some other injury. Nerves are just slow to recover, but I've been able to raise my arm up to about here. I've gotten the ability to walk with a cane back, and I've even been able to walk around my house without a cane a little bit, which is great. And we have 3 young children, so they're able to kind of cheer me on, and that kind of keeps me going. But it is a slow process, and there's no doubt that it will continue to be a process for quite a long time.
If you had anything to tell the audience about stroke, just 2 or 3 things, key things about going through it or understanding it or getting to the hospital, what would you tell them?
I think your point toward there being no age limit to stroke on the young side is very important. I was in very good health just prior to this happening. I had actually gone through a couple of years of recapturing my fitness, and even the week before the stroke I'd ridden a 100-mile bike race and did quite well and had no symptoms whatsoever. And so I felt that I was in probably the best shape I'd been in at least 15 years, and that still did not make me immune to this happening. So this can happen to healthy young people, and it's part of our whole picture of health to remain as healthy as we can, and these things can still happen. But I think the most important message of all is that family members have to be able to recognize subtle symptoms of change. And if somebody's having symptoms, they can't be looked over or put back toward tomorrow. You have to act quickly. And I can't imagine looking back and remembering that conversation, how frightening it must have been for my wife to say to somebody on the phone, I think my husband might be having a stroke. But she was brave enough to say it, and she was right. And it summoned the right people at the right time and got me to where I needed to be. And so that effectively saved my life, that she made that call. And so if someone has symptoms that change, like face drooping, arm weakness, speech change, we need to make that call, and even though it's frightening, be brave enough to say, I'm not going to allow this to persist, because time is of the essence.
So I'd like to also ask you, stroke, the word stroke, used to be a word to you. You're an orthopedist.
Right.
You don't take care of people with strokes.
Generally,
so now,
no.
Yeah, but now you've learned a different vocabulary.
Very much so. And if there's one very positive thing, I think we have to all take the twists and turns that life gives us and make something positive of it. And the positive for me is this has generated an entirely new perspective for me as a physician to what anyone goes through in a hard time, whether they've had a big trauma or a life-changing surgery or a life-threatening illness like a cancer. And although I always felt that I tried to connect to my patients and empathetically understand what they were going through, I definitely have a different vocabulary and understanding now about how hard some things are. The difficulty of learning to walk again, which is something that we've all done since we were about 10 to 12 months of age, is surprising, yet I've treated lots of patients who've had to learn to walk again. Right. And now I know how hard that was, and I hope I didn't gloss over that difficulty for any of my patients. I tried not to, but I certainly understand better now.
We always get a new perspective, don't we?
Very much so, yes.
Before the interview started, you told me that you are glad that you're not 30 years older.
Yes.
And trying to deal with the rehabilitation, and that you have a great appreciation for what an older person would have to do. Would you talk about that?
You bet. So as an orthopedist, a lot of the problems that we treat are age-related, and a very significant number of our patients are older, and there's no doubt that I'm in the younger segment of patients who have stroke. The average age is over 20 years older than I am. And so those patients who are, say, in their 70s who have a stroke, they may not have come into that situation in strong health. And I was pretty strong right before this happened, and it's still been very difficult. Mm-hmm. And so I can imagine as an age-related phenomenon, being 75, this would be incredibly difficult. Yeah. But having treated a lot of older patients and watched them muster the strength and resolve to get through their surgery or their injury, it really has given me a totally new respect for how tough our aging patients are to get through those harder and challenging times.
We're going to stop now from a neurological standpoint, and we're going to invite our colleague, Dr. Lynn Shank, who does physical medicine rehabilitation, also from the Billings Clinic. She does a great job.
Hi, my name is Lynn Shank, and I'm a physical medicine and rehabilitation physician at the Billings Clinic. And I work with patients that have a disability following a trauma or a stroke or many other disease processes. And today I'd like to thank Dr. Mike Willis for sitting with us and being a patient and a colleague with us to help us better express all the needs and the importance of stroke. I would like to first introduce that Dr. Gaddy has been the neurologist that has just been discussing the acute side of stroke with Dr. Willis. And so we're going to take a little turn, and we're going to move down to what Dr. Willis's recovery and rehabilitation have been like and what he can share with us that he has experienced. So firstly, I'd like to ask you, Dr. Willis, when you were down in the Swedish hospital right after your stroke on day 2 or day 3, and the rehab team first came in to meet you, perhaps the speech therapist first, and the physical therapist and the occupational therapist, what can you share with us about that experience and that time?
Well, it was kind of a dark time, tough time, because I had awakened after having had a surgery to relieve pressure on my brain to find out that I indeed was paralyzed on the left side of my body, and I knew what that meant and that it had implications for the rest of my life. And so it was really a tough pill to swallow in those first 48 hours or so. When the rehab team first came to see me, they took me to the rehab gym, which at the hospital was kind of a collective community gym of patients who had had brain and spinal cord injuries. So everyone there was dealing with the same type of injury or worse that I was dealing with. But the real clear first memory of that day I have is we transferred over to the physical therapy mat, which is about as tall as this table. And I sat down, and the therapist said, "Now just sit straight up." And I tried to sit straight up, and my body just toppled over to the side because of this one-sided weakness. And the other part was that my brain wasn't really processing where the center line was, and I couldn't figure out how to hold my body upright, and I just could not do that at all. So it was somewhat terrifying to realize just how profound this injury was and how it had affected my body and my inability to be stable in space.
Did you find the situation to take several days to be more comfortable in going for physical therapy or participating in physical therapy? Or did you find for yourself that it was something you looked forward to that early on?
I looked forward to it because there was a an array or a team of therapists, and there were other patients that I was getting to meet through the process that kind of helped me put in perspective where they were, where I was. And the therapy process itself really is designed to allow patients, whether they've had a stroke or say a knee replacement, to realize what their deficit is and how we're going to get that better. And so through that therapy process, I was really able to see what my deficits were, and they were able to start to outline for me how we were going to work on that.
Perfect. You know, Dr. Willis, many times here at the Billings Clinic, we are a large tertiary care hospital facility for a fairly large region. You know, we service some of North and South Dakota. We service all of the northern territories of Montana, except for the far west, and we service a lot of northern Wyoming. And we have a lot of patients that sometimes are brought here 4 or 5 hours away from home after their stroke, coming from small communities that don't offer much rehabilitation services. And often these folks stay in Billings to rehabilitate, and oftentimes their local communities can't accept them until they have met a certain level of independence or autonomy. Can you explain to us, you completed your rehabilitation about 9 hours away from your wife and your 3 children. Can you tell us some of the advantages and disadvantages that you see in doing that?
Yes, the advantage was that I was able to be in a therapy setting where exclusively patients with brain and spinal cord injuries were being taken care of, and so I was very much consistent with the other patient population that was there in terms of my disabilities and needs in therapy. And although I was away from my children, which was really crushing for 3 months, my wife, to her credit, was with me the whole time, and she's the only reason I was able to kind of get through all of that time. The advantage is that I was receiving specialty care for the disability that I had from my stroke and laying the foundation for my recovery in a way that was very regimented and very tried and true through that process. Other disadvantages were being away from my entire social network here in Billings, which includes all of the people that I work with as colleagues at the clinic and all of my friends here in town. And it was very difficult to be away from everybody, though I would say that the support that I received from everyone around the Billings area, as well as other remote areas back home in Louisiana, and from friends and good colleagues in other places like New Mexico, where I did my orthopedic training, was overwhelming. But the support that I received from people in and around the Billings area, both patients and non-patients, was totally overwhelming, and it was overwhelming in a very positive light. I couldn't believe how much people went out of their way to give me well wishes or to send me notes of very positive nature to get well and to tell me that I was valued, and that every day was very palpable to me and was part of my feeling like I was starting the road to recovery.
And in some of the traumatic brain injury, and this is a little different, the research shows that a social support network is one of the most top prognostic indicators for a good, healthy recovery. How do you feel about that in terms of what you got to experience with rehab and your social support network?
I'm not surprised by that at all. While I was down in Colorado, I had lots of friends, both from the Billings area and other areas, that came to visit me, and we were able to have dinner with them and spend time with them. Some of them I hadn't seen in a while, so we were able to catch up. And then being back in Billings, I've had the opportunity to go on a lot of lunch dates with friends and colleagues, and that's been a huge part of my recovery. And then some people have allowed me to have conversations with them or their family regarding orthopedic issues that they've had. And surprisingly, that's been a huge part of my recovery, because it's allowed my brain to start thinking like an orthopedic surgeon again and to think in the way that I normally am accustomed to thinking, and that's made me feel like I'm recovering at the brain level. And so I very much appreciate all of those people spending that time with me, whether it's stopping by our house to have a cup of coffee or going out to a lunch or what have you. And that definitely has helped me feel like I'm progressing and getting better. And by adding a positive note to my days, some of which are a little tougher than they used to be, that's part of my whole attitude of recovery. So everybody's been a big component to that.
Excellent. When you returned back to Billings after about 3 months down in Denver, you were placed in an integrated program with speech therapy, physical therapy, and occupational therapy, and you were very diligent in attending those sessions 3-4 times a week for quite a period of time. Can you share with us how that was a little different than the inpatient, and how much you gained from that outpatient, that next step of recovery?
Absolutely. The inpatient recovery portion in the beginning, in those first few months, was different in that it was every day, and again, it was in an atmosphere where I was with other patients and their families who had had similar impacts to their lives, and so there was a sense of sharing that I think gave everybody a little bit of a boost in terms of their recovery, but it also allowed families to share their challenges. And for my wife and kids, this has been as hard or harder than it's been on me. And my children lost a whole summer of our normal activities, and that's a big impact on their young lives, and yet they're plastic and they're adapting to it and supportive and moving through it. The outpatient setting here has been great in that it's really fostered a lot of steps toward independence. And I don't think I had, even as an orthopedic surgeon for many years prior to this, a very good grasp on how difficult it is to go home and learn to transfer from a wheelchair to a tub bench or to a bed or what have you. And now I really have that firsthand experience, and the therapy process has allowed us to gain more independence so that I do more for myself around the house. And that now is translating to being a lot more mobile, both in the home and in the community and at therapy. And so they both have had a huge impact on my recovery.
Absolutely. If you had just 2 or maybe 3 in particular things to say about outpatient therapy, we know that they not only allow you to ambulate better, not only allow you to attend to your left side better, not only allow you to return to cooking. I met you in occupational one day and you were making jambalaya, and you did that pretty much independently. What other benefits have you found with that outpatient therapy services, and what 2 or 3 things would you say were the most important aspect of that?
Well, the physical therapy part has probably been the biggest for me because that was the most defined disability. The part that was a little harder to grasp initially was the cognitive injury. In other words, the way that my brain was working. And fortunately, I didn't have a deficit of speech or understanding, which a lot of stroke patients have, and is very troubling to them. You can see when you speak to them in their eyes, if you meet with one of those patients, that it's amazingly frustrating for them. So I was happy I didn't have that. But speech therapy really allowed me to see where the cognitive part of my brain wasn't working like it normally does. And that's been incredibly valuable, because one of the big pieces of this injury that struck me, and I never really understood this piece of injury before, was kind of an identity crisis. I think that previously I had defined myself based on activities that I participated in and my job, and suddenly those were just gone overnight, where there is a chance I'll never get back to operating again. I think I'll definitely get back to seeing patients again, and that's not absolutely too far down the road. But I may not get back to I doubt I'll ever get back to my job as it was the day before I had this stroke. And so those are huge impacts. But therapy is allowing me to overcome those and to see all the possibilities that I have. And the cognitive piece of speech therapy and occupational therapy that's allowed me to re-grasp the way my brain works is what really has allowed me to know that I'm recovering for sure. So the way that I think or process has become more the defining element of who I am, rather than being an orthopedic surgeon or someone who goes and fishes and wades in the river or goes out and hunts, all of which I love doing and I value greatly and would love to return to. But this impairment will affect me the rest of my life in some way or another, so I'm going to continue all of those rehab components in order to see the ultimate recovery that I can. And we don't know how long that will take. As you well know, that could be 8 years in the making, which seems daunting, but at least again I've got this perspective on the potential, and I'm very lucky to have lots of opportunities in front of me to be able to grasp onto, and lots of great friends who help me with those opportunities. and I cannot wait to get back down to the river with friends of mine and learn how to try to walk in the shallow water again and not fall down.
And I do believe you also have one really specific goal, and I think that is to go to the mountains again and
skiing has always been a big part of our family life, and our 3 children who are 9, 6, and about to be 5 are really great skiers and push my wife and I to keep up with them. And so that is an ultimate goal, is to get back on the mountain and ski. And it's a little bit scary to think about it, but I think we just have to put fear aside sometimes and press on. And so it will be absolutely joyful next season when I can get back out there and click into some bindings and allow my skis to slide down a slope in the hopes of chasing down those 3 little kids.
Perfect. Thank you so much, Dr. Willis,
Absolutely.
for participating with us
Thank you.
today, and thanks for taking your time out of your schedule and coming in and sharing your life's experiences. I know this is not easy, and I know that the patients and the viewers of this show will greatly thank you forever for taking this time for us today.
I really appreciate the opportunity. Thank you.